So, Doc, it has been a nerve wracking year. I'm sure it's been very, very difficult for you. Very difficult time for pregnant moms and families. I have a bunch of questions that I felt could help reduce panic, just create some awareness, and also just be able to put some precautionary measures out there without people having to really seek a consult or an appointment. There are some things that I feel that people just need to generally know now. Um, the first question that I have is a slightly softer one. I want to understand, how has the role of an OBGYN changed in the last 1 year?
It's been just over a year that, we really got hit by the pandemic. We went into lockdown in India on the 23rd of March. It's just over a year. Uh, well, the initial response was you were just totally taken aback, but then you immediately got your wits together. We started seeing patients almost immediately, but initially it was just the women who were pregnant who needed to be cared for. We had to put everything else on standby. We didn't know the disease, so the team had to structure appointments. We still do it today. We started with twice a week and then thrice a week. It's completely changed the way we work now. The problem with this pandemic is that it's a pandemic like never before. When I read about the Spanish flu, I couldn't for the life of me imagine how a pandemic could affect the whole world. And here we are in 2021 with a disease that has infected almost 130 million people. And I have to keep reminding my patients and myself that it's already taken over 230 million lives. So sorry, 230,000 lives. That's a big, 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 big number, 2.3 million. We just need to be careful. Well, the way I see it is we've been through these things before. I've seen the H1N1 pandemic. We dealt with HIV. So for the clinician, it's one more challenge to be taken. Our responsibility is even greater because, as we will discuss today, the emotional aspects of what people are going through and women are going through are again something that has never happened before in my practice. Every day is a challenge, but it's a challenge to be taken up. Every moment is a precaution. As of today, I have in my practice 57 women who have either been infected, almost 47, 48 infected, and the remaining having a very close family member. And you can imagine when a pregnant woman has an infection, what it does to her and her family. So one day at a time, we've managed to do well this far. We've got to continue doing this well. All of us who look after others in our own different ways, virtually, in person, physically. We're not delivering babies virtually anytime in the near future. So that's something that OBGYNs can't get away from.
Absolutely.
It's
And
been a privilege at the same time to be there for women in this most difficult time of their lives.
not surprised to hear you say that at all, Doc. It must have been an incredibly difficult time, and honestly, still hard to say when this is going to end for us. Do you find yourself having to counsel a lot more than before? Because I know OBGYNs, they don't have time. Um, but do you feel now, given the way, you were talking about how difficult it must be for a woman to be pregnant? Um, of course, you've seen cases where they have contracted the virus. You also delivered women who've been positive. So we'll talk about that as well, how that experience has been. Um, but just the emotional aspect of women going through pregnancy and the fear, anxiety / panic. What if I get it? How do you cope with that?
So the first thing is that I've come to know about a condition which you all probably deal with, which is called the condition of the worried well. Even the people who are well are going through tremendous psychological pressure and worry. When it comes to pregnancy, the worry starts much before you actually conceive. And a lot of women reached out to us and said, is this the time for us to conceive? Should we go ahead with the pregnancy? In fact, the first 3 months of the pandemic, March, April, and May, were almost, like people, everything was at a standstill. And interestingly, that's also happened that the last 3 months, which is 9 months from March, April, and May, have seen a record drop in the number of deliveries that we did. And then people got their wits about, and people decided that fine, we have a little more understanding of this disease, and everything got back to normal. So here is a woman or a couple who comes to you and asks you, we are really scared, we are really worried, our lives have changed like never before. Is it safe for us to conceive? Is it safe for us to continue a pregnancy? Then there is the patient who comes to me pregnant, and you know what? You don't wait to being asked. You have to start counseling preemptively. So you have to start talking about these things, and I do. Unfortunately, there have been studies which have shown that a lot of providers actually stayed away from this discussion because they didn't want to create in their minds a fear. I think we need to take it head on. Uh, what is a woman afraid of? A woman who's well is afraid that she might get infected, that a family member or someone close to her might have the disease. They are afraid because they hear of deaths. And trust me, in this last 1 year, almost everyone I know knows of someone who they lost. And that's a very, very scary feeling and a sensation. Now, for me, I try to bring a lot of positivity to them, and the positivity is based on science.
Mhm.
I always tell them that COVID has been kind to pregnant women. And by association, COVID has been kind to the obstetrician. The reason why I say that, and I actually justify this to them and say, firstly, there are diseases which cause miscarriage. There is no evidence to show that COVID increases the miscarriage risk. There are diseases which cause birth defects, for example, German measles or chicken pox. There is no evidence to show that COVID causes birth defects in the child. There are diseases which cause stillbirth and growth restriction. We are not seeing that in any big way. I'm not saying that there aren't a few cases reported, and we'll talk about those. But by and large, when you think about the millions and millions of women, of almost 25 or 27 million who delivered in India last year, we didn't see any big increase in these problems. And finally, we haven't found the virus in amniotic fluid, in breast milk, in vaginal secretions. So we are not infecting the baby in utero the way HIV or hepatitis would. Breastfeeding, it doesn't go through the milk, but obviously it can happen with close contact. And that is again something we are dealing with. We've gotten to know this disease better. Now, we were kind of prepared for it, Shwetam, but I'm surprised when people say it took us by surprise. We have lived through 2 or 3 pandemics since the year 2000. We've had MERS, we've had SARS, we've had H1N1. H1N1 took the lives of pregnant women. 7% of people who died with H1N1 were pregnant women. Thankfully, that's not happening, and that's not happened with COVID. So, in general, if you really take a big picture view, here is a disease like never before, which for some reason, while it affects the lungs and the other stuff, doesn't seem to be affecting pregnant women. Now, going one step further, most of our patients are in the relatively younger age group. And COVID is something that has targeted the elderly and people with comorbidities much more. I'm not saying pregnant women don't have comorbidities. So, again, somewhere they are kind of protected. And we deal with it. It's an infection, it's a virus.
Yes.
Doctors deal with infections and viruses, and we have to deal with this one. It's just that the scale of it that has completely overwhelmed the system. I mean, you and I know for the last 3 days, these last 10 days have been traumatic because we are seeing a spike again like never before. I have friends and loved ones and patients calling up asking for help to get a hospital bed, and there are just no hospital beds available. So we just can't let our guard down. At the same time, we shouldn't let this disease overcome us or defeat us.
So, doctor, I have, related to all of the information that you have just given, honestly speaking, would you say that it is, given that the face of COVID, the strain is changing. We hear of the virus mutating. We hear, of new developments all the time. Um, Medicines working, vaccine working, not working. There's just so much uncertainty. Would you say this actually is a good time for couples to plan a pregnancy? A year into the pandemic, would you still hold that advice where, you know, pregnant women are really safe? We don't know how this is going to go for them.
Yeah. So basically, firstly, let's face it, we can't let our lives come to a standstill. And we've learned that. We've learned that when we did it last year, the repercussions have been something we are going to take a long time recovering from. So with all the available information, I think it's for the couple to make this choice. But if a couple, and it's very interesting, a lot of couples came and said, you know what, doc, these were very busy people. Many of the couples you and I look after are both professionals. They've had no time in their lives. They have had no time to even get pregnant. And they say, this is a good time for us. We are not traveling. We are not doing meetings. Could we? And well, my answer has to be yes, these are the facts, and you need to decide what. Now, let's talk about few of the things you just said. Viruses mutate. Okay. Viruses mutate, and we need to keep aware and one step ahead of them. There is no evidence to show that the vaccine won't help with at least the mutations that are happening. The only problem is most of the times our system won't recognize the mutations. So we deal with the virus as a virus.
Mhm.
We need to do a lot of genome testing, which initially we didn't see. Maybe a country like the UK did, so they picked it up first. But now we are seeing in different countries, viruses will try to change, and that's the reality. Vaccines have been something that may be a game changer. And I know there's so much doubt about vaccines being sown. And sometimes I believe social media is such a powerful tool, and sometimes it's an even worse hindrance. So basically, there is a big move. And now I'm going to talk about pregnant women and lactating women. And I just had a call this afternoon, this evening, saying there was this patient of mine delivered 1 year ago, still lactating, who's landed up for a vaccine. And she's being told, should you, shouldn't you, you better decide. We don't test vaccines generally on pregnant women and lactating women. But interestingly, for this particular thing, we have started that testing. We know from our experiences with past vaccines that vaccinations can be given to women, and women, all women, including you, did have an influenza vaccine when you were pregnant. And I believe that maybe in future, this disease is going to become a part of your influenza vaccine. In the US, they've already approved vaccines, the two vaccines they have there, the Pfizer and the Moderna, for use in women and lactating mothers. The World Health Organization is looking at the data. Our International Federation of Gynaecologists is pushing strongly for the vaccine. And I believe that again would make things better,
Yes.
make people more feel more safe, and would be in a way of reassuring people that you will be taken care of. Now the answer about do vaccines work, because we hear all the time about people getting infected after having a vaccine. So one is the complete protection vaccines given. They have everything from say 75% to 90-95%. So when millions of people are taking a vaccine, if you have a 70 or 80% efficacy, 20 or 25% people may still get infected. That's not a failure of the vaccine, that's reality. And the second thing that we have to understand is when they do get infected, and this has clearly been shown in trials, less or no hospitalizations and fewer or no deaths. So I believe this is something we are going to look forward to. I've asked all my patients to be on standby. I'm looking at the data in real time every day, and I'm going to get my patients this the moment it is approved and available.
So you do feel that pregnant women should take the vaccine or they shouldn't take the vaccine?
Not as yet. We have to wait for science to catch up with what we would like. And one thing that's bothered me in this pandemic is sometimes science has taken the back seat. The kind of drugs which came and went, it's not funny. Medicine has always worked on evidence, on trials, but because this came so fast and so hard, we started doing things because we thought it might work. So my suggestion to my patients is, millions and millions of people are taking the vaccine. We are understanding it better. Trials have started. You be safe. Whether you are vaccinated or not vaccinated, you will live in a bubble. This is not the time for you to put yourself out at risk. You are safe where you are with the people you know and you trust. A patient of mine, someone who's very famous, said, I love paranoid people. She was pregnant. She says, because I find they are safe. And this is the time you really need to be around people who will be safe and look after themselves. You need to do this day after day after day, no matter how tedious it becomes. The masking up, the sanitization. Trust me, if me and my staff have managed to go through a year with physical contact with patients coming in, thankfully, without any of us being infected to date, it's just because we went through the disciplined motions every day this last 1 year. Staggered appointments, had people coming in with fewer, just one relative, sanitizing everything between patients, N95 masks, PPEs, face shields. Not only did we make it safer for ourselves, we made it safer for each and every patient of us. So that's what we need to all keep doing, but we cannot stop. We cannot freeze. Well, at the same time, please don't, for God's sake, don't go for holidays to the Maldives, to Dubai, or to Goa. I don't know what's with these three places. I understand the economy of the world is at a standstill and they are dying to have you to go and spend there. This is not the time to do it.
It's incredible that you bring it up because so many people are feeling caged. They report that we're feeling like we're in a jail. We can't take this. We can't tolerate it. And the assumption that getting out of their house, getting out of the state or the country will bring them peace, not realizing that we're in the middle of a pandemic, not realizing that even if they don't um, get sick, they might carry the disease.
Yeah.
This has really been, if I may pardon my French, it has been a shit show. So many educated people haven't been able to grasp this concept of how they could be carrying and actually aiding the spread of such a fatal virus. So yes, absolutely right, that precautions is the way to go. Doctor, what happens if a mother, an expectant mother, is tested positive, and also during her, let's say the last trimester, and also if you have to deliver, uh, at a time where the patient is in active phase of symptoms, how do you manage that?
Yeah. So first of all, women should be assured that they will be looked after. That that fear of abandonment, and let me be, it was unfortunate, be candid here, that there was abandonment that happened early in the pandemic. A lot of doctors panicked. A lot of doctors stopped seeing patients. A lot of clinics were closed down by the authorities because there was one positive case. There, can you imagine if you're registered for delivery at the hospital and suddenly the hospital gets shut down? Where do you go? So this happened, but we still managed and looked after the case. Now I'll give you a very simple case study. I had a patient who was due uh, about now, and she was for a planned Caesar because she had a previous Caesar with a large baby. We do a lot of mandatory testing now because hospitals insist on tests to get in. And that's in a way not a bad thing, because that way you know that everyone who comes in is safe. And she tested positive 2 days before a cesarean. So she was home isolated. Again, fortunately, most of our young patients have been pretty much asymptomatic, the main symptoms having been fever, and obviously loss of smell, loss of taste, but it's like having a bad case of flu, which you can manage with paracetamol. Waited for a week, she was still positive. waited for a few more days, and she went into labor. Now, the hospital she was at doesn't accept COVID patients.
Mm.
So can you imagine what that woman is going through? She's desperate. She doesn't know where she's going to go. Fortunately, we managed to take her to another hospital. And then on what we did was, of course, the Caesar got done. Everyone was in a, you have to see us in PPEs. It's like we're wearing spacesuits. And we do it if we have to do it. And obviously you mask up and you dress up and you do everything. Shwetambara, I don't know. People tell me that masks don't let them breathe, and masks, don't let oxygen in. Hey, you know what? Doctors have been wearing masks forever and doing difficult surgeries and everything in masks, okay? So stop complaining and keep that mask on. She's delivered. Even she was still positive, but with the knowledge we have now, the baby was allowed to be with her. She wears a mask. She takes care, but she's lactating, she's breastfeeding, and she's gone home. So this was just one case, but we've had many cases like that. I think to date, out of all those patients I told you about, at least 10 of them delivered while they were COVID positive. And hospitals have set up facilities. There's a different section they are kept in. We've worked out everything from how the operation theaters prepared, to what care we take, to how we protect them. And by and large, it has worked well. There have been stray instances of complications. And the one dreaded complication that we have is COVID seems to cause a lot of thrombosis, clots in blood vessels. And that's something that we have to kind of take care of and address, particularly if the patient is symptomatic. But we've constantly been learning every day on the job. We have to, like I said earlier, keep going, us, our patients, and yes, I mean, considering that we are having this conversation today, you and I have to tell you about the important role that you and your specialty play for women, because they are afraid, they are anxious. Now imagine someone who starts off with a disadvantage. There are a lot of people who live with undiagnosed cases of anxiety, depression. As a society, we sweep it under the carpet. As a medical fraternity, we are embarrassed to speak about it. We don't want to help a patient by asking her difficult questions because we feel we might offend her. We feel that family members will think that we are trying to, be judgmental and say they have mental issues. And this is the time, I think, to offer help. And a lot of women do accept it. And that's probably bring in the professionals, bring in the counselors, bring in the psychologists, bring in the psychiatrists whenever required. And I think that, I always say you have doctors of the body and you've got doctors of the mind, and women need both of them.
Thank you for that. That is incredibly important, I think, for everyone, and also the medical fraternity to talk about. And I'm so grateful for doctors like you, because I know you value our work because of the referrals, because you do reach out when you feel that a family needs help. But doctor, what do you think has been the reason why, especially in India, pregnant women, families, husbands, conflicting couples, well within their first trimester, even when they're coming for infertility, why do you think counselors haven't got that, that space on a prescription? Um, there is a stigma, we understand it, but where do you think it comes from and what can be done about it?
So, firstly, I think it has to be part and parcel of medical education and training. I think medical education prepares a doctor to be taking care of the physical universe. Other than doing a rotation through psychiatry, when we are looking at very major mental illnesses, we aren't really exposed to the sensitive nature of this particular issue. I believe counselors have to be part of your team. I mean, it may be formal, it may be informal. I believe they are a vital part. You know, having great people on your team makes all the difference. And maybe, I don't know if I'm wrong, I just don't, I feel that we just don't have enough great counselors out there. I may be wrong. I have some great ones in my life, you and whoever else I work with, but I feel a lot of doctors are lacking in having that right person who they can be working with, whom they can trust with their patients. See, when I refer a patient to someone else, I have to have complete faith and trust in that person, that my patient will be handled the way she needs to be handled. So I think that's where we probably have just started wrong. I also believe that we just haven't given space to this in our continuing medical education. I think professional organizations haven't really stepped up. You know, when I'm talking and I'm just thinking, I was the Secretary General of a Federation of Gynecologists. We have 27 subcommittees. We have
Mhm.
no subcommittee on mental health in women. Just a thought. We've got all kinds of subcommittees. Now, unless you talk about it, and sometimes we just underestimate how important mental health is. We are talking here about pregnant women. So I serve on the working group for the World Health Organization South Asia region, and they put before us once, we were working on adolescence, and we looked at the five most important causes of death in adolescence in 11 countries in our region. Two of the five causes were suicides and accidents. Honestly, me, someone who's aware and someone who reads, didn't have a clue that suicides would be there in the top five causes. And what are we doing about it? Next to nothing as a society and as a system. The same thing applies to pregnant women and pregnancies. The same thing applies to patients undergoing treatment for fertility, where the entire burden, the guilt, the pressures, the blame comes onto the woman. So we need someone to step in there. And whenever things get difficult, these fault lines get exposed. I mean, I've seen it when it comes to fertility. I've seen it when there comes to a miscarriage. I've seen it when something goes wrong in a pregnancy. It becomes a blame game. It becomes said or unsaid disruption. People around them take sides, and it becomes a very messy issue. And I've always told my patients, you know what? I can listen to you, and I can. Well, let's face it. First of all, I am biased because I'm always going to look at it from my patient's perspective. That's when I need you, and I need a psychologist, and I need counselors because you're trained to do it. I need that unbiased voice, opinion, who's gonna who's gonna give solutions, who's gonna listen through and work things out. I don't know, maybe, you know, we're having this conversation. I hope it goes out. I hope lots of people on social media hear it. I hope they start talking about it. And I mean, we are not talking about dramatic celebrity situation here. We are talking about day to day millions and millions of women and couples who require this kind of help. And we'll also require a lot of people to take care of them.
This is such an incredible observation on your part, doctor, that when there is a vulnerability, um, a mental health concern can actually surface or resurface or relapse. And pregnancy in itself um, is such a long, sustained period of vulnerability for women, not just the women in question, but also their families. And so you must be seeing so much of this in your clinic. Would you say that in the last 1 year, cases of prenatal anxiety or postpartum depression have increased?
Yes, yes, dramatically. Prenatal anxiety, because besides the anxiety regarding the pregnancy and everything that happens in pregnancy, now the anxiety of the disease. And like I said, it's not just for yourself, it's for your husband who goes to work, it's for your children who are now at home. And let's face it, if you are an older child and you're a parent and you know you're doing this schooling from home, you suddenly value what teachers do.
Touching a very weak nerve there, doctor.
You suddenly
I'm
think
going to
teachers
quickly switch gears into.
are the greatest profession in the world with what they do every day of their lives. I mean, let's face it, these anxieties were always there, but now they've been kind of honed and they've come to a level like never before. Postpartum, again, you know, childbirth is a time when there is family and people, and for the last 1 year, women in hospital have delivered alone with one family member. The ones who had COVID delivered alone with no family member. After you get home, and I know I've got two grandsons who are a year and a half, they haven't met people outside their family for a year. Now, I don't know, but I think psychologists need to take this up as a long term study when you're going to have a whole generation of kids with anxieties to strangers and others, which they normally work out as soon as they get out of infancy, because they've gone a year and a half without being exposed to anyone other than immediate family. Postpartum depressions, for sure. We need to be extremely vigilant. We need to talk about it, right? And let's face it,
100%.
some, yeah,
100%. We need to
and it's
talk about it. And I so agree with the vigilance because I feel that there is firefighting is one side for us right now because we have so much to deal with right now immediately. But what does worry me, like you said, is the long term impact of this on children who haven't been out. And that brings me to my next question, which is that what do you feel will be the long term impact of this kind of a period, crisis, sustained crisis for women, right from, for females, from puberty, menopause, and after? Because hormones and women have been the brunt of many jokes.
yeah.
um, there is this entire cocktail, of juices in us, which basically impacts everything: sleep, appetite, mood, energy, motivation. And then
Yeah.
there has been truckloads of cortisol, truckloads of stress hormone during this period. How do you feel? And not just, of course, very significant pregnant women, but not just them, from puberty to menopause and after, what do you think will be the manifestations of this kind of a period?
So there's no doubt that hormones are a big part of how women live their lives. And hormones change throughout women's reproductive lives as women change. So the disruptions that are happening now also influence hormones because all hormones are controlled by the pituitary, which is controlled by the higher centers. And anyone who looks after women knows how stress, how situations can completely disrupt this most important part of their lives. Uh, Adolescence, let's look at what's happening now: restrictions, less activity, more stay at home, more screen time, more food, more weight gain. Hey, you know what? We're going to have to deal with all those PCOs and obesities as the next few years unfold. During reproductive years, this fear, anxiety, whether they want a pregnancy, whether they don't want a pregnancy. PMS gets honed because of all the hormones they have. Then cortisol gets added to it. So PMS like never before. Women having to multitask like never before. I mean, it was bad enough for them to be professionals and to be mothers and wives. And then suddenly you have these same women having to be teachers. You have these same women working from home. And I have been saying this to patients of mine in HR, and I have a lot of them, patients of mine in HR. It's, HR has really failed us in this last 1 year. HR has failed to protect the boundaries that should have been set when people work from home. I have patients of mine who are taking meetings at 9 o'clock, 10 o'clock, 11 o'clock. Just because you don't travel to work doesn't give work the right to get into your lives, and it is. And they're doing that. Uh, I mean, let's face it, women always had a support system. For a big part of the pandemic, the support system was taken away. So the people who took some of the tasks from your life and did them for you, you were also doing those tasks. Some men did step in, but let's face it, we are still generations away from that kind of equity and equality. Maybe someday it will come, but it definitely hasn't come as yet. So it's been disruptive. And then going to the elderly, well, that's always been a topic which I feel very, very strongly about. People completely misunderstand what happens to women as they advance in age, as they come into the perimenopause, as they hit the menopause. And even today, with all the science out there, society has failed to understand the special needs and requirements of these women. Everything from the physical, the flushes, the cosmetic changes, to the emotional, a partner who's very, very successful and very busy and is trying to balance so many other things that he doesn't have time here, to the children who are now grown up and need their mother less and less often. So it's that. And I think this is again just women just need that support. Men and women need that support, but what hormones do to women, they just don't do to men. So women have that double whammy.
It was almost like you were reading one of my case files. These are things that we do have to constantly deal with. I think another question related to this that's popping up in my mind is that I have immense faith in therapy, but let's face it that a lot of people are not aware, or there still is existing stigma, like we spoke about, that even their family physicians, doctors, don't often prescribe this openly. Do you feel, all of the alternative remedies that are there, to regulate hormones or stress or oxytocin or dopamine, um, can be relied upon, whether it is flower remedies, Bach's remedies, ashwagandha, Ayurvedic remedies? Do you have any faith in these? Um,
So I don't have the scientific knowledge and wherewithal, but I definitely know one thing. I have no business to let my ego come in the way of my patient feeling well. So my honest opinion when they ask me for it is, listen, I don't know about them, but if it's not doing you any harm, you have my complete blessings to go ahead and try anything that works for you, as long as there is some science, as long as you're not stopping responsible therapies and going into alternative therapies. I mean, let's do it complementary, let's do it side by side, and many a times it does help. uh, I don't know why. I don't understand homeopathy. I don't understand acupressure, but I will still ask some of my patients to go for it when I fail to solve their problems. So I'm fine with them. And there again, I think that's where the holistic aspect comes about. And that's where having associations with people. I have some great nutritionists I work with, works wonders for women. If you're just taking care of their health, their gut, and whatever else. uh,
I say a very similar thing to my patients. I believe in everything that I don't know anything about. So, the world is your oyster. If it's
yeah,
going to help you, then I'm a believer in it
absolutely.
too. Um, Doctor, you mentioned nutritionists. I work with one who's incredibly well known, Mr. Luke Coutinho. He has a wonderful pregnancy program, for example. And not getting into the details, but it is mandatory for a client to take a counseling session, at least one, um, try it out when the woman is pregnant. And I think that is such an incredible and responsible thing to do, that you give them this foot in the door, you give them that experience. I think, at the risk of repeating myself, I feel, why doesn't that happen? From the medical fraternity, why isn't there a system where there is a mandatory session, one or two, through pregnancy for couples, or when a girl is hitting puberty, or when a woman is going to approaching menopause? Why don't we actively say that no, there has to be one or two therapy sessions that you need to take?
So firstly, In my practice, it has. It's mandatory.
That I know.
But I do agree, as a profession, it hasn't. So I have this checklist for a pregnancy. I have two nutritionists who work with me at the clinic.
Mhm.
The checklist for the pregnancy includes a diet consult the moment they finish the first trimester. I mean, it's a tick box checklist, so no woman can go past that point without reaching out to the dietitian. Now, what does the dietitian do? I believe they optimize things. I'm not saying all patients do wrong stuff. They get the reiteration that what you're doing is fine. We managed to give optimum weight gain. I have this program called restrictive weight gain in pregnancy, where I have people who are overweight actually losing weight while they conceive. We had a 121 kilo woman who finished pregnancy at 105. It's worked wonders. Incidentally, there's also a dental check which has become mandatory, because I think we need to look beyond the womb. We doctors tend to be very focused on our area of care and expertise, and we forget that there's a whole woman who's attached to that womb who needs looking after. So I completely agree with you. I think a problem primarily has been, Shwetambara, and we are not very good in our country with setting up these systems. Now, I may have been able to set it up in my practice, and that's where they do very, very well in the West. The institution is set up to automatically look after many of these things holistically. I know there are institutions overseas which will offer homeopathy and acupuncture all under the same roof, where they're giving medical care. And I think more and more of us probably need to think big, look beyond, look for associations, direct women to where they will get care that they need. And I just feel you will reap dividends. It works wonders. And at the end of it, when things go well, everyone shares the credit. In fact, a large part of the credit, even though it's not completely deserved, will go to the doctor if the woman does well, because of all these other people assisting us. I so agree with you. Maybe it's again something we need to talk about more openly. Maybe it's something we need to drive the other way. Why aren't women not asking their doctors for this kind of advice? Why aren't women? And let's face it, these days I have to deal with women who come better prepared with information. So I want women to start going to their doctors, or just going and finding this kind of care for themselves. I'm not saying every woman in the country would be able to do it, but a large percentage of our population would. And for the others, again, when I've always believed that medicine is driven by that demanding group of patients, and once they start asking for something, it gradually percolates down to everyone else. That's the history of medicine. So maybe we need to keep this conversation going and tell women how important this is for them.
Absolutely. Very, very significant one. Women always land up leading the way to change. And I think this one might fall in our laps as well. Doc, just one last quick one, which is so significant. And I'm having to answer this particular question with some of my patients as well. Um, let's say the pregnant mother has had COVID, or has delivered with the virus. Now, the baby has been separated for obvious reasons. You did mention that some hospitals are allowing babies close to their moms, but in the case of my patients, babies were kept away. Um, and there was a period of 12 to 14 days where babies were taken care of by nurses. Now, this is a question that, give me a very honest answer. Do you feel our hospitals are equipped with good neonatal and postnatal care under these circumstances? Um, are there options for moms to pick, and tell nurses that I want my child to be breastfed, not given formula? So there are a lot of these questions that they have, a lot of these anxieties: who's taking care of my baby, who's holding my baby, who's feeding my baby, are they well taken care of? So what would you say from the inside? Are our hospitals equipped?
So firstly, I'd like to do this in two parts. The first part is, uh, In this particular case, let's face it, most of the time it's the pediatrician or the neonatologist who's calling the shots. And when we first started, some hospitals kept babies apart. But today, as science caught up, the recommendations came in. Most hospitals are rooming in the babies, even with the COVID positive mother, unless the mother is experiencing complications and is in the ICU.
Let's stop you just for a second. How does that work, doctor? How is that safe for a newborn baby to be
Okay.
in the
Okay.
same room with a COVID positive patient?
Okay. So interestingly, it works exactly the same way, where you have, first of all, this baby is being born through the mother. The studies that we have from all over the world and the WHO gives its recommendations say that the harm caused to the baby by keeping the baby apart and not breastfeeding is far, far greater than any risk the baby might have of contracting COVID. So the mother's wearing a mask, the mother is sanitizing and wearing gloves, the mother is wearing otherwise a gown, you wipe clean the breast, and the mother can definitely feed. Okay, so that's what's happened to my last few patients. The babies are in the mother's room and no baby's gotten infected, which is the great thing. Unfortunately, you're right, there are many hospitals in which the babies will be kept apart. Most of the time, you ask the mother to pump and give the mother's milk, which is what's important, and formula is used to kind of supplement the deficit. Most of the time, again, we don't keep the mothers in hospital for a very long time. And particularly with COVID, most hospitals tend to want the mother to move soon. The mothers want to go home soon because they are all alone. And in that situation, once they are home, you got to educate and train family members of how to care for the mother and the child. And nowadays, the recommendation is not even to retest to say that 14 days afterwards she's not infectious anymore. And most of these tests have happened before she delivered. So if she tested positive, say 5 days before she delivered, then maybe another 9 days after delivery, she is absolutely fine. So we got to work it tough because people are afraid. Neonatologists don't want to take a chance. Mothers themselves don't want to take a chance because they are petrified of infecting the babies. And here, let science, let recommendations, and this is where recommendations help. If the Association of Pediatricians and Gynecologists and World Health Organization is telling you you can do it, you can do it. Now I come to another thing, and I just have to say this, and this bothers me. I think we are all committed to breastfeeding.
Hmm.
There's no doubt. But sometimes I think this commitment has gone to the other extreme, and we are creating a lot of anxiety in women when they fail to breastfeed. And the system has been very insensitive and very judgmental. And while this does not have anything to our discussion on COVID, I keep telling my patients the pediatrician is just looking after the baby. I need to take care of you and your well being. This is a woman. She cannot be going 24/7 forever without taking a break herself. There is going to be a break point. Please, society should not judge her, should not set her standards. If she has less milk, she feels inadequate the most of the time, isn't in her control. And I think anywhere we work with human beings, we have to have balance, and we have to have balance, and we have to have sensitivity, and we have to have acceptance. Now there may be that occasional patient who does not want to breastfeed. Well, she also needs the acceptance because that's also a choice she makes. And then to shame her and say that she's some kind of a bad mother, nobody else has any business to do. So at one level, when it comes to COVID, let's follow the science, and then let the mothers decide what they want to do, not the nurse or the pediatrician. When it comes to these other women, support them. Every woman today wants to breastfeed. Every woman today is not always able to breastfeed. So whatever happens, make sure that you don't, emotionally hurt her, torture her, make her feel miserable. Be understanding and give her the space.
So lovely to hear.
Pediatricians are not going to love me saying that, but too bad. This has become such a political issue. It shouldn't be a political issue. It's a personal issue.
You say it so well, doctor, that there, I mean, the key things, key words, key takebacks for all of us has to be acceptance, sensitivity, empathy. This is not an easy time for anyone, especially for a pregnant mother, a new mother, taking back a little baby home. So a lot of empathy and sensitivity required over there. Parting words, anything that you want to say um, to women in general?
Well, I think society has to have the utmost admiration. I once wrote an editorial in which I said that, that book was dedicated to women because women put themselves and their lives at risk for the future of humanity. Childbirth carries its risks, and women still do it and keep doing it. And let's face it, what they are doing is something that couldn't be more altruistic. Uh, my my prayer to women is that please, when you do all this, do not uh, hold back. If you need help, ask for it, shout for it, scream for it. It's your entitlement. If you want to make your voice heard, damn well make sure you make your voice heard. Do not let everyone else decide and choose for you. Nobody can have your child's and your own interest at heart better than you. Nobody. You are genetically programmed to do what you're doing. If it feels right, it is right. You know better than the doctor, you know better than Google, you know better than anyone else. And finally, there's something I tell my women patients when they're going home. You're going home with a child. The next few months are going to be challenging. You will be rewarded maybe once or twice a day with a little smile, but this baby is going to be messy, it's going to be hungry, it's going to be demanding. Unfortunately, people don't tell you that. They glorify this phase in your lives. It's not going to be easy. And that's why it takes a village to raise a child. So please, please mobilize the village, use the village, exploit the village. It'll be the best thing for you and your baby both. And at the end of it, of course, I mean, look at the miracle of life, that this is how life just goes on. And it's all thanks to women.
It has been such an incredible talk, Doctor, for you to bring, not only talk about childbirth, but parenting, which is a completely different ball game. Of course, there's an experience of gestation, there's that period, and then delivery, the whole birthing process, and then taking the baby home, and then it's one challenge after another. So reaching out and asking for help is so incredibly important. And I think those are really, really valuable words. Thank you for every minute of this conversation. Like you said, I do hope that a lot of people see it, hear it, and find value in it. Thank you, thank you, thank you. Very
It
grateful.
was a privilege, and Shwetambara, it's always such a delight engaging with you and speaking to you. Thank you, and thank you for all that you do.